So after talking about non-allergic rhinitis and different types of non-allergic rhinitis, our another topic of this lecture is the nasal polyps or nasal polypi. First, we will talk about the ethmoidal polyps. The bilateral ethmoidal polypi, they are present on the both sides. They are bilateral. What's the pathogenesis of bilateral ethmoidal polypi? How they present? What are signs and symptoms? And also we will talk about the treatment of the ethmoidal polyps. What are the nasal polyps? They are non-neoplastic. They are not neoplastic. They are not tumors. They are non-neoplastic masses of edematous nasal or sinus mucosa. So in the polypi, nasal polypi, it's not only the mucosa of the nose or nasal cavity, it's also the mucosa of the sinuses which is involved, which becomes edematous and swollen. They are the growths, they are the masses, but they are non-neoplastic masses. They are not neoplastic. So that's the main difference between the nasal polyps or any polyps from the neoplastic growth. So they are non-neoplastic. Here if you see in this diagram, these are the ethmoid sinus polyps present in the ethmoid sinus, and these are in the maxillary sinus. Types are ethmoidal, bilateral ethmoidal polypi. The ethmoid, these three are the ethmoidal polyps. And then we have antrochoanal type of polyps. So we have two types of common nasal polypi. We have ethmoidal and we have antrochoanal. Depending on their site of origin and their location, they are divided into two types. We have ethmoidal and antrochoanal. So ethmoidal polyps, causes of these ethmoidal are chronic rhinosinusitis. So if there is not acute rhinitis, and sinusitis usually do not cause commonly the polyp formation, but it's chronic, it's over the period of long time, or if it is acute attack keeps on coming and going and it becomes chronic, it's the leading cause, very important cause of formation of the polyps is chronic rhinosinusitis. Asthma and aspirin intolerance can also lead to the formation of polyps. Asthma is also an allergic response to the different antigens, and its aspirin intolerance also can lead to the formation of polyps. Cystic fibrosis. If you see in this diagram, this is the normal lung. This is the lung with cystic fibrosis in which the cysts are formed. Lungs become fibroids. Fibrosis develop. They have cyst formation, and with the fibrosis, the lungs become unable to function properly, and there is this is the picture of cystic fibrosed lungs. And if you see the very clear difference between the normal lungs and how the cysts are formed in these lungs in the cystic fibrosis. Allergic fungal sinusitis, so fungal infections that can cause sinusitis also can cause ethmoidal polyp formation. Cartagener syndrome is also associated with the ethmoidal polyps. This is the syndrome in which the cilia are not functioning properly, so there is infections. Different infections can occur because the different foreign bodies, organisms, they are not cleared because of the failure of cilia, which are hair-like projections, to function normally. Then the Young syndrome is another cause of polyp formation. Churg-Strauss syndrome is also associated with polyp formation. And then nasal mastocytosis. All these are the nasal this is from the mast cells, cytosis. Cyto is for the cell, mast cells are associated with allergic reaction. When they are burst, when they open up, they release different chemical mediators that can lead to the allergic response and inflammation. So all these are the common causes of formation of polyps. And if you notice all these causes, the mechanism of action behind these all causes is the same, that it can cause rhinitis, it causes sinusitis. All sinusitis and rhinitis cause the edematous mucosa, excessive secretions, excessive production of mucosa, and as a result of that changes, there is bulging or protrusion of the nasal mucosa, lead to the polyp formation. Here in this diagram, this is the normal airway, and this is the airway which is in the asthma, which is the blocked airway. So all these are the common causes of ethmoidal polyp formation. Pathogenesis, how it develops. These are the pictures of the polyps, masses or growths here. These are the polyps. Pathogenesis is what happens is there is edematous mucosa in middle meatus and turbinates. There is swelling of the mucosa, edema of the mucosa, mainly in the turbinate and in the middle meatus. This then causes polypoidal changes or changes that lead to formation of the polyp. There is collection of extracellular fluid, the fluid that comes out or secretions. There is collection of those extracellular fluid which is out of the cells. And then later on, with sneezing and with different, there is pedunculated polyps form. The polyps are of two types. We have sessile polyps and we have pedunculated polyps. Sessile polyps are the polyps with no stalk. This is the sessile. They have no stalk, but if you see here, these are the polyps which are hanging down with the help of the polyp. These are the pedunculated polyps. These hang down with the help of the stalk. So the changes or the pathogenesis is first the mucosa becomes swollen and edematous, then polypoid changes occur. There is collection of extracellular fluid, and then there is polyp becomes pedunculated as a result of sneezing and pressure. They hang down. Then metaplastic changes occur in the columnar epithelium, and there is excessive serous fluid in submucosa. Infiltration with eosinophils and round cells occur. So all these are the different changes that can lead to formation of the polyps. Begins with the edematous changes in the mucosa leading to polypoid changes, collection of extracellular fluid, then the polyp become pedunculated from sessile, there are metaplastic changes in the columnar epithelium. There is excessive serous fluid in submucosa, and then after that there is infiltration with the cells, which are eosinophils and round cells. Site of origin of ethmoidal polyps. This is the ethmoidal polyps. So the common site is the lateral wall of the nose, is the common site of the polyps, lateral side of the nose. The ethmoid sinus is the sinus which is present between the nose and the eye. So the lateral wall is the site for the formation of ethmoid polyps. Usually from the middle meatus. The origin is from uncinate process, ostia of sinuses, bulla ethmoidalis, and medial surface and edge of medial turbinate. So all these are the sites from the origin of ethmoidal polyps, lateral wall of the nose, and then we have uncinate process, and then ostia opening of the sinuses, bulla ethmoidalis, and medial surface and edge of middle turbinate. All this is the middle turbinate here. So medial surface and edge of the middle turbinate. So these are the common sites from which ethmoidal polyps can develop and form. Symptoms of the polyps are, you can very easily see them through the nostrils. Sometimes they get big enough, they cause complete obstruction. So symptoms are multiple polyps can present, multiple polypi. Nasal stuffiness occur, loss of sense of smell because of obstruction, headache due to sinusitis, sneezing, watery nasal discharge, and mass protruding from the nose. So if the patient comes and complain of nasal obstruction, when you elevate the bridge of the nose like this, even without this nasal speculum, it's very easy to see the polyp coming out of the nose or hanging in the nose or present in the nose. So, and then if it's present, then definitely it's causing obstruction, it's causing loss of sense of smell, headache. All these can occur as a result of polyp. Signs are what the doctor will see. There is grape-like masses, smooth, pale color, and there is discharge from the polyps. Vascular simulating neoplasm. Polyp protrusion from the nose, increased intercanthal distance. If polyps are present in this area between the nose and the eye, so this, if the polyp is present, the distance between the intercanthal distance is increased between the two cantha. So intercanthal distance is increased. Multiple and bilateral, they are on the both sides. That's important feature of ethmoidal polypi, bilateral. They are multiple and they are present on both sides, and can be sessile or pedunculated. I already mentioned sessiles have no stalk, pedunculated have stalk. So all these are the different signs of the polyps. Diagnosis of the polyps is first and foremost clinical examination, very important. You can see the polyp right in the nasal cavity on examination. CT scan of paranasal sinuses. So CT scan of paranasal sinuses is performed. Histological examination, this is the histological histologic picture of the polyps. Treatment is a conservative treatment, and then we have surgical treatment of the polyps. The conservative treatment of the polyps is use of antihistamines, excuse me, use of antihistamine and steroid is effective. That's the conservative treatment of the polyps to relieve the symptoms which are associated with the polyps. Allergy control is another conservative treatment. Then the surgical treatments, polypectomy is very common procedure done in ENT, OPDs, wards. Polypectomy is the removal of the polyps, but the bad thing is they keep on coming if the person has chronic sinusitis and chronic rhinitis. So polypectomy is removal of the polyps. Intranasal ethmoidectomy. Intranasal ethmoidectomy is cells uncapping by intranasal route. Extranasal ethmoidectomy through medial wall of orbit, an external incision is given, as the name shows. It's extranasal, outside the nose, so it's through the medial wall of the orbit from here. Transantral ethmoidectomy through the antrum of the ethmoid. This is done. Polyps in maxillary antrum. Then Caldwell-Luke approach is used for this type of surgery, which is transantral ethmoidectomy. Then we have endoscopic sinus surgery. In this, the endoscopes of 0, 30 degree and 70 degree angulations are used. So all these are the surgical methods of the treatment of ethmoidal polyps. So that was all about the bilateral ethmoidal polyps and how they can present and what's the management and treatment. Thank you for watching sqadia.com.